I'm honored to work with the GYN oncology staff. I've been with them for 21 years, 10 of which as a nurse practitioner. I have the honor of overseeing the chemo center and seeing the patients for follow-up. And I have to say that I'm very devoted and dedicated to helping survivors navigate their lives when they're initially diagnosed, as well as along the path to survivorship. I just want to give you a little background. In 2006, a paper came out which was entitled Surviving Cancer, from Cancer Patient to Cancer Survivor, Lost in the Transition. So many individuals came together from various oversight bureaus. This was a national movement to develop a plan to help the cancer survivorship community. At present, I think we have at least 13 million cancer survivors. How about that? And it just touches my heart to be able to engage with people, to help them, and to serve people, actually. I feel more of a servant than a provider, because that's the least I can do. If I can give hope to my patients, along with my wonderful physicians who also have the same theme, I believe, philosophy, we never give up. We are always there to help the survivors transition through the treatment and follow-up care. So I would say ovarian cancer is a very tricky cancer that needs to be given special attention. And I would like to leave it open to questions, comments about your experience with dealing with the treatment phase, the surgery, and also just to mention that the family, the significant others are also considered survivors. So I look forward to entertaining any questions. There are certain symptoms that we find very prevalent, and what I try to do is anticipate by individualizing care to each patient and anticipate the types of things that individual ladies might have as issues. And Brooke is a wonderful resource for me, because many of the things I do not find as my actual specialty, I welcome their input. I'm always referring to our lymphedema and pelvic floor specialists. The physical therapy aspect has just made such a huge difference in the quality of patients' lives. So, Brooke, would you like to say a little something about yourself?
All right, let me know if you can hear me, because I'm so tall. Does it come up? Maybe. No, there we go. Whoa, there. Took a college education for that one. All right. My name is Brooke Kolisiak. I'm the owner of Legacy Physical Therapy. I am a board-certified women's health physical therapist, and at Legacy Physical Therapy we specialize in pelvic rehabilitation, and we also provide lymphedema services. So I work with many cancer survivors with various different long-term side effects. So one of the most common things that I'd say I work with is the situation of pelvic pain with returning to intercourse and intimacy after your cancer treatments. And so it's an unfortunate side effect of the treatments and the potential surgeries and that come with the cancer diagnosis. But as experts in the musculoskeletal system, physical therapists are a great partner to help you kind of navigate that, and specifically physical therapists who are trained in women's health issues and pelvic rehabilitation can be a great partner to help you kind of get back to that normal level of intimacy and intercourse with your partner, as well as partnering with you for kind of general level of function and general exercise and activity level. So looking at you as a whole and seeing what are the activities that you want to be doing and want to get back to, and how do we transition you back into that, so that it is you being able to do exactly what you want to do to lead your active and healthy lifestyle. So a physical therapist can be a wonderful partner for that, as far as devising a plan to help, rehabilitate muscles, or to improve cardiovascular endurance, or to help navigate any pain symptoms that might be limiting those functions. So they are simply, or we, I keep saying they, we are simply one partner that can help along the way to keep you moving forward with your survivorship and getting back to what you love to be doing. Kind of like Nancy said, I would, instead of me just talking up here to you, I'd love to kind of open it up to any questions that people want to throw out there as far as related to survivorship and some of the long-term side effects. And if not, then we can definitely continue to talk on different topics in that. But does anyone have any particular side effect questions? Or we got a hand right away. All right.
I'm still going through chemo, but I've had a really tough time with neuropathy. Gabapentin is all that they, have given me, and that's all that there's an answer for right now. They say, I try and do exercise as well. I ended up hurting myself with my ankle because I couldn't feel, have any feelings in my feet. Probably worse than my hands. My hands I can use, but sometimes it bothers me. I'm sure other people have the same thing. I'm just wanting to know, is there anything out there particularly to help you cope with that?
If you want to speak on the medical side, then.
See how little I am?
There, see?
Test. Actually, we have new literature. There was actually a double-blinded study done. Paroxetine is one, but we like Cymbalta. Cymbalta has shown great promise. It's duloxetine, sorry. With duloxetine, or Cymbalta is the trade name. And to start, you could start 20 minutes a day. It's prescription. You'll have to ask your physician about that. But Cymbalta has shown great promise in our studies. So this is research-based information.
Great, I'll do that then.
In the back, follow up to it.
Yeah, please.
Because I was taking Cymbalta for that. I was taking 60 milligrams.
You got up to 60.
But I had to go down to 30 because it upset my stomach.
Yeah, it does have side
Just
effects.
in case. I just wanted to say.
Thank you, dearest.
Repeat the question.
The question was that the patient has a significant neuropathy in her feet. She's been on gabapentin, which can be very effective, but it also has side effects. So I just want to say that our patients are all very individual, so we need to cater to your individual needs. But we have found from the evidence-based literature that Cymbalta has been excellent, and I actually started a patient on 60 milligrams. I was being a little too ambitious, and she really felt awful. We've cut her right down to 20, and she's, because she needs to stay on a particular trial that we have her on, a clinical trial, and we need to take care of this neuropathy.
I found with neuropathy, I know we were just talking at the table here, B6 and B12 was recommended.
Do you have anything to add, Brooke? Please interrupt me. Hit me.
I'm not going to.
2 a day, of course, I was taking whatever they sell at Walmart, and it worked for me. I mean, I'm a swimmer, and I could feel,
Wonderful.
I could feel it in my feet. And you can't take more than it. But well, ask your doctor what.
Yeah, actually, it's a water-soluble vitamin, so you're going to urinate out what you don't need, so it's not going to hurt you. Although there's some information that you might just monitor it.
It took like 8 weeks.
Yeah, be patient. Even with, like, for example, if you have problems with your joints, Osteobioflex is a wonderful, wonderful complementary supplement that you can take, but give it time. And I wouldn't do without it. I'm afraid to go off of it, actually, because I have a back issue.
I also did the vitamin B, and then I also took it a step further. I started eating more alkaline, which is a lot more green, so a lot of your broccoli.
Good,
your
yeah.
spinach. And it took a lot of the joint pain away and the neuropathy. And I also, I mean, I'm a big time fighter, but I continue to walk, even if I used to walk 4 miles a day, and I was down to maybe a mile, but I still did that walk.
That heroin.
One of us are
Yeah, we're going to kill ourselves.
Move the muscles and the joints, But that's what I did. But I had immediate relief on my joints from eating more green and cutting out some of the dairy. It's not good for you. You need some, but I just got immediate. I mean, it was like the next couple days that I had no more joint pain. So that's another.
To follow up on what she's saying there, as far as kind of keeping as mobile as possible, that's definitely important. And when you're going through a treatment, that the fatigue level is so high, and but to try and be as active as you can be, whether it be walking, swimming, that kind of stuff. Yes, you do need to break up your activity level and
Yeah, but I feel better and I feel like a functioning person and not just a blob of pain or whatever.
But especially with the neuropathy, it's really important that you have a good pair of walking shoes and supportive shoes, that you're not getting compression on the feet. A lot of people tend to hold on to their gym shoes for a long time. They have a shelf life, and so honestly, I really recommend, especially if you're doing a lot of walking, you need to be replacing them every 6 months. Most people hold on to them 2 to 3 years. But if you're doing kind of low level of walking where maybe you're only doing like a mile, if that a day, you can probably make it last out to a year or so. But you want to be fitted for a nice, very comfortable, cushiony, supportive shoe. Because if you're having really bad neuropathy, you're not going to feel when it's going to blister or you're getting too much pressure over a point. So you really need to have that supportive shoe in place. And then you also want to try, along the lines of staying as mobile as possible. Our nerves like to move. They like to glide in our body. So when we're kind of more stationary, sitting more, laying down more, those nerves don't get that healthy movement through the body. So even the most simple of kind of a movement routine where you kind of start either at your head and go down or at your toes and come up and move your joints in each of their various directions that they can go. It sounds silly, but spend 5 or 10 minutes a day where you maybe start, so my wrist can go up and down, I can go in circles, I can open and close, and then I go to my elbows and I bend them. Then I go to my shoulders and go the different directions. I turn my head and then I walk it down to the feet. Nice and simple. You can do it in sitting, you can do it in laying down, but you're moving everything through its range versus it being more stationary. And so that just helps to improve circulation and improve the blood flow to it, and kind of, we were a body that's designed to move, so when we become more and more stationary because we're going through medical treatments and that really can affect our health throughout our whole body. Did you have something to add, Nick?
I know you have a question, but I just want to add one quick thing. I do a Walk Away the Pounds tape, and I don't know if anybody's familiar with Leslie Sansone. Oh, baby. And I also do Zumba, Beto. No. Well, let me tell you, get on the internet, and you could stand in front of your television for 15 minutes and do a mile, and it's not going to put you down. If anything, it's enlivening. She's kind of a character. She never stops talking through the whole tape. But go to Walmart. It's inexpensive. She actually has a number of tapes that you can just slide into your DVD player, and I faithfully do that. It's like brushing my teeth in the morning. I go downstairs and I do my tape, and now I'm up to a half an hour.
What's the name of the song?
Leslie, Walk Away the Pounds. Yeah. Leslie Sansone, S-A-N-S-O-N-E, and I introduced this to a patient. Her husband started doing it. They came back into the office. They were like wild people, because they were argumentative usually, but they stopped arguing. I wonder why they stopped arguing. Anyway, that'll help with sexuality. Mm-hmm.
Inserts, put it in the tennis shoes.
Yeah.
Because the support on the tennis shoes
So do you have anything to say?
Feet massage, you're going through that thing. I have a massage therapist, I go to her resume, but she would spend a long time working on my feet, and it always helped.
Did it not cause you to have a lot of pain when she was rubbing it?
No, she was really gentle about it, and just, I don't know what it is, it's just, I think it helped with the circulation of my feet, and because they were so numb.
Gabapentin. It's actually an anticonvulsant, believe it or not, anti-epileptic pill. And then antidepressants are also good for the nerves that you can also take advantage of. Isn't it a fascinating deal?
This just in regards to Leslie. If they want to try it out, you can rent it at the library.
Leslie Sansone, yeah. You could try it out. It's not expensive, however. It's like you could spend $20 and have like 5 different DVDs, and you could do one particular one for each day of the week. I mean, I'm getting pretty crazy with it, actually.
One of the things that's helped me, I've got pretty bad neuropathy, and I wear tennis shoes all the time with orthotics, but my doctor never suggested any of these medicines, so that's interesting. That's really helpful. I'm grateful for that. But I have a lady that has diabetes told me about this. It's called Neuragen, I think it's Neuragen. You get it at Walgreens. It's a homeopathic ointment or salve, and it's just in a blue tube, and it's all natural. It's like bergamot or whatever. But when I go to bed at night and my feet are burning,
That's
and
wonderful.
I can't go to sleep, I put that on the bottoms of my feet, and it's the only thing way I can get to sleep. You can use it up to 3 times a day.
It's wonderful.
It's just topical, and it just treats the symptoms, but I will say it's helped me. So just
Thank you. Thank you so much. Neuragen.
Neuragen, yeah.
Neuragen.
I think N-E-U-R, like
Neuragen.
Yeah, it's in a blue.
Yeah, topical things can really help. Some people have chronic pain. I saw a patient yesterday. She had a hernia and she was worried it hurt. So I gave her literature about hernias and what to watch out for. But I also told her she could put a hot water bottle on her. Well, hot water bottle, you could tell how old I am. A pad will do it. You know, sometimes a little cool and warm might do the trick.
Well, a lot of the tips are coming out, but I was going to ask you, is there a way for someone who's just starting treatment or going through treatment to mitigate or avoid some of the side effects?
Actually, I'm so glad you brought that up, because what we have a tendency to do is kind of feel, oh, I have to take this life-saving treatment. I better not tell my doctor. It's very important that you tell your doctor or nurse that you're having this issue, because typically our gold standard is Taxol and carboplatin, and these are both hard on the nerves, but what we can do is substitute a sister drug, Taxotere, for the Taxol. So any of you that are getting treated can have less of a risk of developing a more severe neuropathy by just a switcheroony, you know, of Taxotere from Taxol. So please speak up to your doctors and nurses about your symptoms. Symptom management is huge, and it can make a huge difference. We want you to have a good quality of life, and we want to avoid these symptoms, these late effects. That's the goal of our talk here. So,
When you have the symptoms of neuropathy, is it something that goes away like after so many months of treatment, or is it like a lifetime?
well, it can be either. It can go away completely, and it can linger for years. So that's why, speak up, let us know. Sorry?
Repeat the question.
Oh, the question was, will neuropathy go away, or will I have years of this symptom? And I just told you that it's possible that, depending about everybody's an individual. Some people are more prone to having it linger and stay for many years. That's why you can't ignore it. Please let us know.
So I've been taking B6
Yeah.
for months, and it doesn't seem to be helping. I have it in my hands and feet.
Okay.
And sometimes I notice I'm also more sensitive to cold.
Yes.
Like
Oh, that's
in
big.
meeting rooms or anywhere. I'm very sensitive to cold, much more so than I was.
Yes.
So should I try increasing my B6?
How much are you taking?
Just 1 tablet a day.
Oh my.
Oh, yeah.
You can take up to 400 milligrams a day.
Oh, no.
Oh, yes. And then let your doctor and nurses know. I don't know if I mentioned this in the beginning, but we have survivorship care plans that we're giving out at Siteman Cancer Center. and I intend to be giving them out as soon as the person is diagnosed so that I can connect with them, give them reassurance, and monitor their care and have all the information initially down so I'm not like a crazed person at the end of treatment with everybody waiting for these things and not getting them out on time. So,
what's the difference between the prescription drug for neuropathy and taking like a B6 or a B12 supplement?
well,
how would the doctor determine if you need a prescription drug?
Well, what we'd like to do is start with the over-the-counter vitamins because those are very homeopathic. And then if that's not working, we could also complement it with a prescription gabapentin or Cymbalta.
So
but if it's
prescription drugs stop the progression of the neuropathy, or does it help with the pain?
both. You can do both.
Okay.
Yeah. I wish I knew how it worked physiologically. Yes?
I recently completed radiation therapy.
Please jump in.
The short-term and long-term side effects that I should be aware of or anticipate, so maybe I can mitigate some of those symptoms.
Yeah, well, if you've had pelvic radiation, there are organs, even though nowadays, should I repeat the question?
I think you're answering, repeating it in your answer, aren't you?
I'll try. She's asking about what are the key long-term side effects that she should be concerned about having had radiation treatments. Now, depending upon how much radiation you had and where you had it, and nowadays if you had it at Barnes-Siteman Cancer Center, we have a IMRT, which is a fabulous computerized system to give the treatments. So you're not going to have the risk that the patients had in the olden days, where they would have terrible bowel effects and bladder effects. But so kind of monitor yourself if you're having pain with urination or you're having diarrhea. You know, let us know about it. I always make sure that there's not a urinary tract infection. And eventually these things should go away depending upon how much you had and how long ago you had it. But some people tend to have it for, you know, a few months following. But you'll be following up with your physician and radiation therapist, I hope, and bring it up, and they'll help you with that. But watch the foods you eat. If you have a tendency towards diarrhea, then you need to be cautious with not eating the high fiber foods that you're used to eating if you were so inclined before your treatment. But this doesn't have to be forever. You have to kind of play it by ear. I've had patients who are actively being treated talk about, oh, some days I'm constipated and other days I have the runs. And you have to be calling your nurses and also making sure that you're responding to your needs at the time. So I don't know, I hope that answers your question.
I've got some.
Here's more.
There's more. So I'm looking at a room full of women who are in my prime age of what I'm working with a lot of times in the general population who are not even dealing with cancer treatment as far as having urinary issues. And that's so women in their 40s, 50s, 60s, and 70s dealing with urgency, frequency, and bladder leakage issues. And so if we throw cancer treatment such as radiation on top of that, that is a big disturbance to the area. You know, like Nancy said, it's much more focal than it was in the past, which is wonderful, but that still can have a big effect on your pelvic floor. The pelvic floor muscles, for those of you who don't know, go from your pubic bone in the front to your tailbone into your back, and they go from side to side, your two sit bones that you're sitting on right now. So everyone right now is sitting on their pelvic floor muscles right now. And these are the ones that are commonly referred to as doing a Kegel exercise, okay? So there have actually been research studies that show that 40% of women who are told to do Kegels are doing them incorrectly when you're trying to do them. So we're gonna have a little Kegel lesson right now, just so everyone knows. So everyone kind of sit in your chair, rock back and forth, and feel your bottom bones, okay? Yes, I know some of us have more padding back there and it's harder to feel our bottom bones, but they're there, okay? So now I want you to try and draw a line between those two bottom bones there, okay? And your vagina should be roughly in between there for those of us in the room who have vaginas. Sorry about that. So what you want to think about if you're doing a Kegel or a pelvic floor muscle contraction correctly is that your bottom bones, the pressure that you feel on the chair right now, that stays the same, but you're trying to lift your vagina up off the chair a little bit. So you should feel a tiny lift in between those two bottom bones, but your butt should stay on the chair. So I should not see heads popping up and down out of the chair like, I'm doing it, this is me. Everything else should stay still, and it's just a gentle raise up in the middle there, okay? That is a proper contraction of the pelvic floor muscles. It's just as important that you relax those muscles too. So we have a tendency to kind of hold stress in certain areas of our body. One of the places women commonly hold stress is up here in our shoulders. They end up in our ears, and we're like, oh. And then you kind of roll them out, and you're like, oh, okay. We commonly hold stress in our pelvic floor too, and now we throw cancer treatment on top of that. Those muscles might have a tendency to be hanging out like this, and that can give us urgency, frequency issues. And so it's just as important to be able to let them go. So I'm by no means saying you need to walk around all day tightening. You actually need to let go too, okay? So but it is in good practice to periodically throughout the day just do a little contract and relax. That is a pumping action. It helps to get the blood flowing to the area, helps with circulation, helps keep the muscle function going in the right direction so that as you're going through cancer treatments that the muscle function is still performing well, because we want that nice healthy muscle to be working as well as it can be, because the various treatments can have an effect on it and kind of lessen its performance. So we don't want it to be that it lessens it so much that you end up with leakage or urgency or frequency issues. You want to kind of have that built up ahead of time. So does that kind of make sense? All right, cool. That was my spiel. You back there, yeah. And you, yes, you, sorry. Yes, you in the black. Sorry, I'm tall, man, I just look high.
Mm-hmm. I guess it's a side effect, but anyway, it's not. I'm not going to be repairing it because I'm in between treatments and blah blah blah. So, in terms of exercise, how does that affect doing exercises?
Perfect.
Given that I've been, as we all have, go
slice down the middle.
And I have this hernia.
Gotcha. No, thank you for bringing that up. And that's so. For those of you who don't know, an umbilical hernia is where we get this extra little kind of pooching out right at the belly button, and it can happen from the scar tissue just not being as solid a connection as what our usual tissue is there, and so we get some bulging out that can happen there. One of the things that you want to be very careful of, and actually this is good form for everyone, not just someone with an umbilical hernia, is that when you are exercising and or doing some lifting, groceries, laundry, grandkids, kids, anything like that, that you want to get in the habit of engaging your pelvic floor, your abdominal wall, and breathing out all at the same time. So for some people, that's like I just said, try and do this, okay? But what I want you to think about is you shouldn't be holding your breath to do any exercise. So if you have to hold your breath to do something, it's too hard. Right now it's and when you do that, it puts lots of pressure out on the abdominal cavity and on your pelvic floor, and that's very stressful for those weakened walls, okay? So you want to be able to breathe out, which is something that a lot of women don't think about. They think, oh, I'm going to draw in or I'm going to use my abs. I've got it, don't worry. And we hold our breath and we create all this pressure. So I want you to kind of get in the habit of when you're going to do something more forceful, like say this weighed a lot more than, well, actually this is pretty weighty. So this has got a little bit of weight to it. So I'm going to lift this up, but before I lift it, I'm going to take a little breath in. I'm going to, as I breathe out, I'm going to think about drawing my belly towards my spine a little bit and lifting my pelvic floor a little bit and keeping that turned on while I do it, okay? So engaging before I move, okay? So that's something to think about when you're out walking, just trying to be like, okay, I'm there and I'm breathing and I can hold this. It's something to think about while you're lifting. If you're doing any kind of, you know, arm or leg exercises, you want to make sure that as you're doing the exercise, it's not creating that bulge out, okay? If it is creating the bulge out while you're doing it, we need to modify that exercise so that you have the support there to be able to move appropriately. We don't want to repetitively put the pressure out on it. Okay, does that help? Okay.
So going back to your ab exercise question now, it's been a year for me. I worked out pretty much from day one.
Awesome.
I was told to move no matter what. If I could walk one driveway with my dog, I had a puppy at the time, I went. So now I'm pretty much doing what I was doing before.
Cool.
I was in instant menopause because I was not there yet. So did that. So I've gained my weight back that I lost during all this. But my issue is now my stomach. It's like at first I was like, well, I'm not going to do any ab work. I was kind of afraid. And now I'm like, okay, I think I should be moving on. And it doesn't hurt to do it, I just don't want to.
Gotcha. All right. No.
So what are good? Is there like, I mean, is there any like planks, that kind of stuff? Is there anything we should not be doing?
Gotcha. So again, individualized is best for what level you're at, but you guys all have my personal recommendation. You can take this to any trainer, to any doctor, to any nurse, anyone who says you should go and be doing crunches. You can say, Brooke Kolisiak of Legacy Physical Therapy says do not do crunches, and put my name on it. I'm fine with that. They can call me and say why. But that's the only exercise that I almost always say don't go back to, because I've had a lot of women who's like, oh, I used to wake up and do 50 crunches in the morning to start my day. To me, a crunch is like rolling up an old tube of toothpaste. It's a lovely visual, but you know, we've all rolled up an old tube of toothpaste. You roll it down to squeeze stuff out the bottom, okay? Let's roll our body down to squeeze stuff out the bottom. We don't need to create all that extra pressure down here where we've had all of this going on, all this treatment, for the sake of strengthening our abdominal muscles. Our abs, yes, they're meant to bend us forward, but they're meant to support us up. They're meant to twist us. They're meant to kick in before I do any of my crazy arm movements that I do when I talk. Every time I'm moving my arms like this, my abs are kicking in a little bit to support me while doing that. So in the most basic sense, I want you to be able to breathe out and draw in at the same time. So I am holding mine in a little bit while I'm talking to you right now, okay? I don't walk around 24/7 like this, but I know how to engage them and turn them on. And then from there, you have to be able to hold that basic movement while you then move forward from there. And so a plank is a good exercise if you can continue to breathe and hold that in while you do that. Does everyone know what a plank exercise is? All right, well, you guys might have to stand up, but this is a plank where you're holding in this position. Okay, I'm not holding that for very long. No. Okay, that's very challenging, okay? That's a challenging exercise. The most basic level of a plank is on your hands and knees. So if it's too much to get down on the floor, do it on your bed. Be on your hands and knees and try and draw in, okay? Other good ones are holding in and doing a leg lift. Not two legs at the same time where your tummy bulges forward while you do it, but moving one leg at a time. And I'm a big fan of turning any exercise at the gym into an ab exercise. So if you're doing, we could all do it right now. Everyone put your arms over your head. Okay, everyone take a breath in and pull their belly in, okay? And now I want you to imagine you're pulling 100 pounds down and feel your abs. Can you feel them kick in more? Now we didn't pull 100 pounds down, we just imagined that we did. But our abs got ready for that. They said, wait a minute, I gotta be in there. So you can turn. So you're gonna be here, you breathe out and pull in your abs. And I want you to think about your abdominal muscles. Think about those guys going tight as you pull your arms down. And you should be able to feel them kind of engage a little bit more. Now, if you haven't ever done ab exercises in your life, that may be a little hard to feel right now. And that's where maybe working with a therapist might be helpful for you that way to help you gain that support. But I gave that as an example because you can turn any exercise that you're doing, if you're doing a strength circuit at the gym, into an abdominal exercise.
I have a recommendation to go to Walmart. I need to be given some money for it. They need to pay me for no, Walmart has reasonably priced goods, and buy AM and PM Yoga Jane Fonda. AM, I kid you not.
Videos.
You should see what she looks like. She's in her 70s. She's beautiful. And this is how long is it? 15 minutes per exercise. And you could just tone and tighten with yoga. And it's very invigorating, actually. So that's what I want for you, is vibrancy, and for you to be invigorated and tone everything up. And it takes time, but it's a great workout. AM and PM Yoga by Jane Fonda, yes.
I have the neuropathy also, but a physical therapist told me, not a cancer-related physical therapist, what about those big exercise balls? She said that would help with balance. Then I was wondering, I mean, like, what do you do with them?
Just throw them.
I mean, I could roll all over. I'm not really what it's designed for.
Whee! All right, so yeah, the big Swiss balls or exercise balls, they come in all different sizes. They are used for many different things. I actually sit on one at my office, like that's my office chair, because when you sit on the ball, you actually have to engage without your real knowledge of engaging more through your core muscles to stay upright and not roll the heck off the ball. So I use it as an office chair in that respect. There's lots of things that you can do on it. So rolling on the ball is not a bad thing. Like doing little circles around or rolling it side to side and front and back. You're using muscles around here to do that. It's a great unstable surface to do some strengthening on. So if you have some hand weights, you're sitting on the ball and you can do shoulder press, you can do bicep curls, you can do triceps. So you can do all of those arm exercises sitting on an unstable ball, okay? And you can make that easier or harder. So easier, I'd have a wide base of support, so I'm feeling pretty solid on it. And that harder, I'd bring my legs really close together, or I'd try and just be on one leg, okay? And that's gonna challenge your balance on the ball more, okay? So you can do it that way. You can be, I don't have one here to show you, but you can be where you kind of roll out on it and your shoulders are on the ball and your feet are on the ground, so you're actually kind of laying down. And you can do bridges, lifting your bottom up and down, or you can do chest exercises. So anything that you would do in sitting or laying down, you can do it on the ball, and it just brings an extra level of core stability into it because you have to not fall off the ball. Yes, Beth.
Services like Legacy offers, are they covered with insurance?
Yes, so most insurance plans cover physical therapy services, and most physical therapy companies will call and verify what your insurance benefits are ahead of time. If they don't, I would honestly ask them to. We do that at Legacy Physical Therapy, and I think that that's just because everyone's plan's a little bit different. So the reason why I say that is plans are changing this day and age. And so a lot of times physical therapy is covered, but it might fall under your deductible. And you might have a $5,000 deductible that you may or may not have met. So although it's covered, you might be responsible for the payment of that until the deductible is met. Okay, so it doesn't mean that it's not covered, it just means you got to meet your deductible first and that. But oftentimes the deductible doesn't apply and it's simply a copay, you know, a $20 or $40 copay situation. So yeah, and every insurance company is different too as far as Blue Cross, Blue Shield is pretty standard, 20 physical therapy visits a year for everything. That's what they give, and that they don't really go beyond that. But other ones, it's kind of per condition or what's going on. So make sure that the physical therapy company that you're working with, that they check that ahead of time. I'm a big fan of knowing, we let our patients know what they're potentially responsible for so they have a rough idea versus me seeing you a couple times a week for the next, several weeks, and then you get a big bill from us and that not knowing ahead of time. So that's one of the services that we offer there, is just to make sure you know ahead of time. Yeah.
I just want to mention the yoga, that the cancer support community has a great yoga class.
They do.
And it is free of charge.
They definitely do. Highly recommend taking advantage of that. Yeah.
You talked a lot about neuropathy, but what about lymphedema? What are treatment plans for that?
So the question was that we've talked a lot about neuropathy, but what about lymphedema? We could spend hours talking about that. My first and foremost treatment plan is trying to prevent it. Because lymphedema is a lifelong condition that as a potential side effect of cancer treatments, and it's where our lymphatic system is not properly reabsorbing the excess fluid in our body, and we can get swelling that takes up both legs, one leg, the lower part of the leg, come up into the abdomen. It comes in any shape and size. And so the gold standard treatment plan for that is called complete decongestive therapy, where you are working with a lymphedema therapist to do what's called manual lymph drainage to help get the lymphatic fluid moving up towards places where it can properly get drained. And then you are bandaging after that to keep that limb at a smaller size, and doing some exercises and teaching you kind of daily skin habits and that to be cognizant of. That the active phase goes on for as long as we're seeing significant size decrease in the limb. And then once we kind of plateau out where the limb is either back to kind of the size of the other one, or it's kind of plateaued at where this is where it is, then you get fitted for compression garments and you're taught how to continue with the manual drainage on your own or with a partner at home. And it is a management thing. It is not that at this point in time there is no cure for lymphedema. Some people manage it very well and have almost no symptoms. Some are always dealing with one limb being larger than the other. On the preventative side of it, so if you know that you have lymph nodes that have been removed from one side or the other, you want to avoid, as you can, procedures on the limb of the side that the lymph nodes have been taken out of, okay? That goes a lot more for arm and breast cancer patients, that a lot of times people get blood sticks in their arm, and you want to avoid the side where lymph nodes have been taken out. It's not as common with the leg that there are procedures that are occurring there, but you could have injury in that area, and if you do have an injury to that leg, you are more at risk for lymphedema to happen. You want to make sure you're wearing sunscreen, that you're not getting sunburnt, because that can set it off. You want to be careful when you're shaving. It can be set off as simple as a nick can set it off. I don't say that to scare people, but that is a possible thing that can set it off, is getting a little nick and then it gets infected, and then poof, that's enough to kind of set the symptoms into place. And that, because what's happened is that we've taken out some of the, think of it like a toll booth. Our lymph nodes are these toll booths that send the fluid through. And effectively what's happened with the cancer treatment, we've taken out half the toll booths. So the other remaining half, in a normal situation, they're doing okay. They can keep everything along. But if we start overloading that system where we get sick, we get an infection, we get a sunburn, those remaining 6 toll booths, they can't cover that load. And that's when we get the backup and the problems. So the minute you notice any change in limb size, you want to be bringing this up. You do not want to wait until, like, oh my God, like my leg is huge now. Now I really need to do something about it. Lymphedema is much better managed when caught early. You can do a lot more for it and keep the symptoms to a minimum when it's caught early.
One last piece, and I know you have to settle us down here. Also, if you get an insect bite or if you develop a rash, a cellulitis needs to be treated with antibiotics. So you need to call the doctor or the nurse right away if you should develop, any kind of cellulitis-looking rash on your leg. Sometimes patients need to be hospitalized. So
I'm going to add one. I know I got to cut off. I'm going to add one more thing to it. Not that you're already going through a lot with the cancer treatment. I really would recommend measuring both your legs at the start of your cancer treatment. I don't think there's any studies been linked to lower extremity lymphedema, but on the breast cancer side of it, there have been studies that show that measuring early on, you will detect a change in the size of the limb a lot sooner if you have measurements from the beginning and then you're kind of checking it every month or so, versus if you just wait until you're like, huh, that arm looks bigger. And so you can catch it earlier, and again, you can affect it a lot better. So what I recommend as far as measurements is doing circumferential ones, so around the ankle, probably mid-calf, around the knee, around the thigh, and just have a little spreadsheet, and you have it on both sides, and you just do it once a month, and just nice and quick, just to kind of check if they're within like a ½ centimeter to a centimeter of each other, you're good. And that if you're starting to notice a trend that one leg is getting bigger, that's when talk to your nurse, talk to your doctor about it, that you're picking up a change and something should be done with it.
And don't go on an airplane without compression stockings.
Correct,
on.
I forgot that
Support
one.
hose, very important.
Mm-hmm.
He's pushing her over here.
Yes,
it
definitely.
So that's another thing, be careful.